Today, we're diving into something that is, no joke, a landmark moment in global health. For the very first time, the World Health Organization has released a comprehensive global guideline on fertility care. This is huge. It's the first time we've ever had a single, unified, evidence-based roadmap to tackle a health issue that touches millions upon millions of lives. And to really get why this is such a massive deal, you have to start with this number. Just let it sink in for a second. 1 in 6. It's a simple, powerful statistic that immediately frames the incredible scale of what we're talking about. That's right. 1 in every 6 of us, all around the world, will experience infertility at some point. This isn't some niche issue affecting a small group of people in certain countries. Nope, it's a fundamental part of the human experience, and it cuts across every border and every income level. And that's exactly why one global standard is so desperately needed. All right, here's our game plan for this explainer. First, we're going to really understand the scale of this challenge. Then, we'll look under the hood at how the WHO actually built this thing. From there, we'll get into the nitty-gritty of prevention, diagnosis, and treatment. And we'll wrap up by looking at the big picture goal, making sure this care gets to everyone who needs it. Okay, first up, a global health challenge. Let's really dig into why a global standard for fertility care wasn't just a nice idea, it was an urgent necessity. So everything in this new guideline is built on this official definition. And I want you to pay close attention to that one word, disease. By framing infertility as a disease, not a personal failing or some kind of lifestyle choice, the WHO is making a powerful statement. It's saying this is a medical condition that deserves to be a core part of healthcare, period. Now this is fascinating. For so long, the conversation, the stigma, the burden of infertility has been placed almost entirely on women. But just look at the data. It tells a completely different story. If you add it up, male factors are involved in nearly half of all cases. This is a total game changer because it proves that effective fertility care has to mean looking at both partners. It's a shared issue. And this right here is the mess the guideline was created to solve. Before this, the system was frankly a disaster. You had this wild patchwork of different policies, zero consistent funding, and the quality of care could be completely different from one clinic to the next, let alone one country to the next. It created these massive inequities, and it became so clear that we needed a single, global standard to bring some order to the chaos. So, how did the WHO go about building that solution? Well, that brings us to Section 2, the evidence-based guide. And the process of how they made this is just as important as the recommendations themselves. Let me tell you, this was not thrown together over a weekend. We're talking about a multi-year, 5-step deep dive involving experts from all over the world, clinicians, scientists, and even patient advocates. They sifted through all the existing science and used this super rigorous method called the GRADE approach to basically rate the quality of every piece of evidence. It's that meticulous work that makes these final recommendations so powerful and so trustworthy. Okay, this is super important to understand as we move forward. You have to know the lingo. When the WHO recommends something, that's a really strong statement. They're basically saying this should be the standard of care. But when it suggests something, that's more nuanced. It means the evidence is a little less certain, and the right call really depends on a good, honest conversation between the patient and their doctor. All right, with that foundation laid, let's get into the practical stuff. Section 3 is all about prevention and diagnosis, the absolute first steps on this journey. What I love about this is the focus on proactive, simple, low-cost steps. It really drives home the point that good fertility care isn't just about expensive, high-tech procedures. It actually starts way earlier, with empowering people with basic knowledge about their bodies, their lifestyle, and their health. It's a huge reminder that this all begins long before anyone even thinks about walking into a fertility clinic. But what happens when prevention isn't enough and a couple decides it's time to seek help? Well, the next step is a systematic, cost-effective diagnosis to really figure out what's going on under the surface. So, for a common problem like blocked fallopian tubes, the guide points to 2 main methods, one using an X-ray, the other an ultrasound. And this is actually really smart, because by recommending both, it gives doctors and clinics flexibility. They can choose the best tool for the job based on the tech they have, the training of their staff, and what's right for the individual patient. And for the guys, the focus is all about common sense and reducing unnecessary stress.
If a semen analysis comes back normal, the guideline says, great, don't do it again. If it's abnormal, hold on, wait at least 11 weeks before retesting, because things can fluctuate. This approach avoids needless tests, extra costs, and a whole lot of anxiety for patients.
So, you've got a diagnosis. What happens next? That brings us to Section 4, Pathways to Treatment, where we look at the WHO's evidence-based options. This is so important. Before we even talk about specific drugs or procedures, the guideline lays down these core principles of care. And the big takeaway is this: put the person, not the procedure, at the center of everything. It's about being patient-centered, cost-effective, and making decisions together. It's a truly human-first way of looking at medicine. And here's a perfect real-world example of how this guide changes things. For women with PCOS, which is a super common cause of infertility, the guideline now suggests a specific medication, letrozole, as the first thing to try. This isn't a guess, it's based on solid evidence, and it gives doctors and patients a clear, effective place to start. For those really frustrating cases of unexplained infertility, where there's no obvious cause, the guide lays out a clear, step-by-step game plan. Notice how it starts with the least invasive thing, just waiting a bit longer. Then it moves to IUI, and only after that to IVF. This kind of logical, stepped approach is designed to stop people from being rushed into intense and expensive treatments before they're really needed. And that all brings us to our final and maybe most important section: making care accessible for all. Because this guide isn't just a document for doctors. It's meant to be a powerful tool for health equity. This quote right here just nails it. This is the ultimate goal. It's about using science and a commitment to equity to make fertility care a normal, standard part of healthcare, available to everyone, everywhere. It's about finally serving that massive 1 in 6 population we started with. Another thing that's really great is that the guideline is totally honest about what we still don't know. It points out these huge gaps in the research, especially the lack of data from lower-income countries and not enough focus on what patients themselves actually want. This isn't a failure. It's a call to action for the entire scientific community, saying, hey, here's where we need to focus our efforts next. And so we end on this big question. The WHO has done its part. They've given us the evidence-based roadmap, the science is there, but turning a guideline on a piece of paper into a reality on the ground, that takes political will, that takes funding, and that takes advocacy. So the next step for all of us is to figure out how we turn this incredible document into real, tangible action, and finally ensure that the ability to build a family is treated as a fundamental human right, not a luxury or a privilege.